Taking care of your body is an act of self-respect and empowerment, and that includes the delicate skin around your most intimate areas. Vaginal skincare is a topic that's often overlooked or clouded by misinformation, but understanding the do's and don'ts can help you maintain comfort, confidence, and optimal health. Whether you're dealing with irritation, dryness, or just looking to establish a healthy routine, knowing the basics is essential. Let's explore the most important guidelines for vaginal skincare, dispel common myths, and focus on what truly matters in maintaining the health of your vulva and vagina. First, it's important to distinguish between the vulva and the vagina. The vulva refers to the external genitalia, including the labia, clitoris, and the opening of the vagina, while the vagina is the internal canal. Most skincare concerns and products are meant for the vulva, not the vagina itself, which is self-cleaning and requires very little intervention. Let's start with the do's. The most fundamental rule is to keep the area clean but gentle. Use warm water to cleanse the vulva daily. You don't need any special soaps or cleansers. Plain water is often sufficient for most people. If you feel you need more, choose a mild, fragrance-free, and hypoallergenic cleanser that's designed specifically for sensitive skin. Harsh soaps, body washes, and scented products can disrupt the natural pH balance, leading to irritation, dryness, or even infections. Another important do is to wear breathable underwear, preferably made of cotton. Cotton allows air to circulate, reducing moisture buildup, which can promote bacteria and yeast growth. After exercise or swimming, change out of damp clothing as soon as possible to keep the area dry and comfortable. Good hygiene also means wiping from front to back after using the bathroom, which helps prevent the spread of bacteria from the anus to the vulva and urinary tract. Moisturizing can be beneficial if you experience dryness around the vulva, especially during menopause or after certain medical treatments. Choose fragrance-free, non-irritating moisturizers. Products like pure coconut oil or specially formulated vulva moisturizers are often recommended, but always patch test any new product on your inner arm first to check for sensitivity. Regular gynecological checkups are also a do. These visits are vital for screening, preventive care, and discussing any concerns about irritation, discomfort, or unusual changes. If you notice itching, burning, unusual discharge, or persistent odor, don't try to self-diagnose. Consult your healthcare provider for evaluation and guidance. Let's talk about what to avoid. The list of don'ts in vaginal skincare is just as crucial as the list of do's. First and foremost, don't use harsh soaps, douches, or scented feminine hygiene products inside the vagina. The vagina is self-cleaning thanks to beneficial bacteria known as lactobacilli, which maintain a slightly acidic environment to protect against harmful bacteria and yeast. Using douches or internal cleansers can disrupt this natural balance, leading to irritation or infection. Similarly, avoid using powders, sprays, or deodorants on the vulva. These products may promise freshness, but they often contain ingredients that can irritate the delicate skin, leading to allergic reactions, inflammation, or even long-term issues. Don't use exfoliating scrubs, loofahs, or rough towels on the vulva. The skin in this area is thinner and more sensitive than other parts of the body, making it prone to microtears and irritation. Gentle patting with a soft towel is sufficient for drying. Another common mistake is shaving or waxing without proper preparation or aftercare. If you choose to remove hair, always use a clean, sharp razor and shave in the direction of hair growth with a gentle, fragrance-free shaving gel. Waxing should be done by a professional who understands the sensitivity of the area. After hair removal, soothe the skin with a gentle, fragrance-free moisturizer. And avoid tight clothing to reduce the risk of ingrown hairs or irritation. Don't ignore discomfort or unusual symptoms. Persistent itching, burning, swelling, sores, or changes in discharge are signals from your body that something may be wrong. Rather than self-treating with over-the-counter remedies, seek medical advice to identify and address the underlying cause. When it comes to products marketed specifically for vaginal or vulvar use, proceed with caution. Many feminine washes, wipes, and sprays are more about marketing than real health benefits. Some may even do more harm than good. The simplest routines are often the best. Your body already knows how to take care of itself. Let's address some myths and misconceptions. One common belief is that the vagina should smell like flowers or be completely odorless. In reality, every woman has a natural scent, which can vary with the menstrual cycle, diet, and overall health. A mild, musky odor is normal. A strong, fishy, or foul smell, especially if accompanied by discharge, may indicate an infection and should be evaluated by a healthcare professional. Another misconception is that vaginal discharge is inherently bad. In fact, normal discharge is a healthy sign that your body is cleaning and protecting itself. The amount, color, and consistency of discharge can vary, but as long as it doesn't have a strong odor or cause discomfort, it's usually nothing to worry about. You may also hear that tight clothing or synthetic underwear causes infections. While these can increase moisture and warmth, which may contribute to irritation or yeast overgrowth, infections are typically the result of an imbalance in the normal flora, not just clothing choices. Still, choosing breathable fabrics and changing out of wet or sweaty clothing promptly is a good preventative measure. If you are sexually active, using protection and practicing safe sex are also part of vaginal skincare. Condoms can help prevent sexually transmitted infections, which can affect the health of your vagina and surrounding skin. After sexual activity, gently cleanse the area with warm water and urinate to help flush out any bacteria that may have entered the urethra. For those who menstruate, choosing the right feminine hygiene products is another consideration. Whether you use pads, tampons, menstrual cups, or period underwear, opt for products that are unscented and made from materials that do not irritate your skin. Change them regularly to maintain hygiene and comfort. Let's talk about lifestyle factors too. Diet and hydration play a role in your overall skin health, including the vulva. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins can support your skin's natural barrier. Drinking plenty of water helps keep tissues hydrated and healthy. Avoiding excessive sugar and processed foods may also help prevent yeast infections for some individuals. Stress management is another key aspect. High stress levels can disrupt your immune system and hormonal balance, making you more susceptible to infections or skin flare-ups. Prioritize sleep, physical activity, and relaxation techniques to support your body's natural defenses. For those with specific medical conditions, such as vulvodynia or lichen sclerosis, special care may be needed. Work closely with your healthcare provider to create a customized skincare routine that avoids triggers and supports healing. Medications, topical treatments, or lifestyle changes may be recommended in these cases. During pregnancy and postpartum, hormonal changes can affect the skin around your vulva and vagina. You may experience increased sensitivity, swelling, or dryness. Continue to use gentle, fragrance-free products and discuss any concerns with your obstetrician or midwife. As you age, you may notice changes in vaginal and vulvar health due to declining estrogen levels. This can result in dryness, thinning skin, or discomfort. Moisturizers designed for the vulva, regular checkups, and open conversations with your healthcare provider can help manage these changes. Finally, remember that your body is unique. What works for one person may not work for another, so pay attention to how your own skin responds. If you try a new product or routine, introduce changes gradually and monitor for any irritation or discomfort. In summary, the keys to healthy vaginal skincare are simplicity, gentleness, and awareness. Avoid harsh chemicals, fragrances, and unnecessary products. Stick to gentle cleansing, breathable fabrics, and regular checkups. Listen to your body and don't hesitate to seek professional advice if you notice changes or have concerns. Empowering yourself with accurate information and a thoughtful approach to care can help you feel comfortable, confident, and healthy. Your intimate wellness is an important part of your overall well-being. Treat it with the care and respect it deserves.